Welcome to everybody. I'm sorry I can't quite see everyone. And thank you for joining us for today's discussion. My name is Joel Kanter, and I've had the honor of being a board member of this organization for almost 30 years, and the privilege of being the board chair of the Coalition to Stop Gun Violence and our sister organization, the Educational Fund to Stop Gun Violence, for the last 15 years or so. I say privilege because I believe that gun violence doesn't have to be a tragic fact of daily life. And I believe that our organization has not only been one of the most innovative in the field with respect to solutions, but has also put in the work, to then build state and local support for those initiatives. What I've watched happen as a result has thoroughly convinced me that the Coalition's approach to creating evidence-based solutions to stop gun violence is the best path forward. We're eager to share more about this approach with you today. But before we start today's conversation, I'd like to take a moment to recognize the considerable generosity of many of you on the call today who have contributed to our programs, as there is no doubt that you have helped us save many lives. So thank you. Our vital work would not be possible without your incredible support. And in the hope that past donors, or those of you new to our work, will be inspired by today's discussion, I'm including a link to our donation page in the chat where you can make a gift to either start supporting or continue supporting our life-saving work. For my family, the decision to make this organization one of our highest philanthropic priorities has been rewarded, as have the investments made by our fellow board members and so many of their friends, by the concrete steps the Coalition has made to make communities safer. I hope that some of you will be inspired to join us by the program today, as we believe that with additional investment, we could accomplish even more. Thank you again for sharing part of your day with us. We know how valuable it is, and to learn how we can end the nation's gun violence crisis. And now it's my pleasure to introduce the Coalition's Executive Director, Josh Horwitz, who will host today's discussion.
Thanks, Joel, and thanks for everyone for joining us today. We're very pleased to host today's discussion about the future of gun violence prevention as we look ahead to the start of a new administration and a new Congress. For those of you not familiar with the Coalition and the Educational Fund, we use a public health and equity lens to identify and implement evidence-based policy solutions and programs to reduce gun violence in all of its forms. We seek to make gun violence rare and abnormal. And we're hosting today's discussion because we are approaching a pivotal moment of political change, and we wish really to think about and explore how applying a data-driven public health approach to stopping gun violence is the best tool to address this crisis. We're honored to have three distinguished guests with us today who are among our strongest partners, and all of whom champion a public health approach to stopping gun violence. So first, Congresswoman Lauren Underwood, who serves Illinois' 14th Congressional District. She is the youngest African-American woman to serve in the U.S. House of Representatives. Congresswoman Underwood is a public health nurse, and prior to election to Congress, served as a senior advisor to the U.S. Department of Health and Human Services, where she helped implement the Affordable Care Act, yay, and help communities prevent, prepare for, and respond to disasters and public health emergencies. As a strong supporter of addressing gun violence, and the gun violence epidemic, Congresswoman Underwood is a member of the Congressional Gun Violence Prevention Task Force. Thank you for being here with us.
Well, thank you. I'm so excited.
Good. I'm also pleased to welcome Miranda Viscoli, co-president of New Mexicans to Prevent Gun Violence. After the Sandy Hook shooting, she suspended her work on a PhD in arts at the University of New Mexico in order to research and write about the problem of gun violence throughout the country and through the state of New Mexico. She has worked with schools, school boards, police departments, legislators, city councils to implement gun violence prevention measures. Thank you for being here, Miranda.
Thank you, Josh.
Also joining us soon will be the City Attorney of Los Angeles, Mike Feuer. Mike has served as LA's chief lawyer and prosecutor since July 2013. During this time, he has brought a problem-solving focus that combines fair prosecution and public safety. A national leader in preventing gun violence, Feuer created the City Attorney's Gun Violence Prevention Unit and has worked aggressively to keep guns out of the hands of criminals as well as other people who should be prohibited. With the LAPD, he created protocols to assure domestic violence perpetrators do not have weapons. In a groundbreaking national effort, Feuer joined with the Manhattan District Attorney Cyrus Vance Jr. to co-found and chair Prosecutors Against Gun Violence, an independent, nonpartisan coalition devoted to prosecutorial and policy solutions to end the crisis of gun violence. I'm also very pleased to welcome some of my colleagues on the call, some of our wonderful staff members. We have Dakota Jablon, who is a Director of Federal Affairs. Dakota uses her public health background to advocate for evidence-based gun violence prevention policies on Capitol Hill. She's also an expert in firearm suicide prevention. Jen Pauliukonis is the Director of State Affairs. She learned her craft building that portfolio in state affairs as the Executive Director of Marylanders to Prevent Gun Violence, and she's currently studying, working on her MPH at the Johns Hopkins Bloomberg School of Public Health. And also, finally, Lauren Footman, who's our Director of Outreach and Equity. Lauren brings deep experience in human resources and corporate responsibility, having oversaw talent management and diversity inclusion programs at global organizations. Moreover, she has worked with local and national partners at the intersection of civil rights and gun violence prevention. Welcome, all of my great colleagues. Thank you all for being here. I'm really excited for this discussion. I want to hear what everybody has to say about ending gun violence. And I also want to let people know that we are going to be able to have, we'll have a Q&A. If you have questions throughout this, you can put your questions in the Q&A, and that we will get to them, at least some of them, at the end of this program or later in the program. But I want to start with this. Why are we taking a public health approach to stopping gun violence? It's simple. Because the approach is effective. You define and study the problem, identify risk factors, and then develop and implement prevention strategies. And when you invoke community partners, it is even more effective. This strategy is the same strategy that's worked to eradicate diseases like polio, reduce smoking deaths, and decrease motor vehicle crashes. And here's the good news. It's already working in gun violence prevention. Our organization, with our partners, have worked to pass 18 extreme risk protection order bills in just the last 5 years. Just this year, at the beginning of this year, we passed more than a dozen important gun violence prevention laws in the Commonwealth of Virginia. We recently released a report outlining this approach, and we'll share that link with you in the chat. But here's really the secret sauce. Combining a public health approach with strong community partners saves lives, and that truly is the path forward. So as we get into that discussion, let's start with Dakota, and why don't you start with Congresswoman Underwood?
Thank you, Josh, and welcome, Congresswoman. Thank you so much for joining us today. It is really an honor to have you with us. Before we discuss Congress, I thought it would be interesting for our guests to know that you have your master's in public health, which I may be biased, but is critically important, especially right now in everything that's affecting our lives. So I'm wondering if you could share a little bit about how your public health background informs your approach to drafting and advocating for gun violence prevention legislation.
Absolutely. And I love that you have this public health background and this organization really centers public health in your work. You know as well as I do that gun violence is a public health threat. And by that, I mean, it's a major cause of death and disability and injury in our country. And for that reason, we need to have a public health approach towards prevention. And I see that we have so many systemic problems here. And so we have to have a systemic solution. And so, when we talk about like physical health, like lung cancer, for example, it's not enough to just research treatments that help individual patients get better, right? Like that's important. We have to look at root causes, and smoking is a systemic problem that underlines lung cancer. And so that's why we invest in things like smoking cessation programs and limiting kids' access to cigarettes. And so to me, that's the kind of approach that we need to take to gun violence. It's not random. Right. And I think that for some reason, we've allowed that to creep into the way that our culture discusses gun violence. It's not inevitable. And obviously, many other countries don't have these kinds of problems the way that we do, the same kinds of gun violence rates. And so we know that there are alternatives out there. We know that we can prevent deaths and save lives. And so we have to treat this like we would treat any other public health issue and tackle the root causes in a systemic way. And so there's another thing that I've really brought with me from my public health background is a commitment to evidence-based policy. So research is essential. And that's why I'm so proud that we were able to get funding for gun violence prevention research at NIH and at CDC in last year's appropriations package. It was the first time in 2 decades that public health researchers get federal funding to do this work studying gun violence. And I'm going to fight to make sure that we protect this funding and grow it because this is a really important area of essential research. And we need to take the next step and really learn from those findings to implement the policy changes to keep Americans safe and save lives.
Thank you so much. It is so exciting to talk to a fellow Hopkins alum, but it is just so refreshing to speak with a legislator and especially someone in Congress who actually gets public health and why it's so important. And I'm just so excited that you're here.
Thanks.
So turning to the new administration and Congress, can you share some of your thoughts about where you see opportunities to pass gun violence prevention in the coming year? What type of bills do you think can get through both the House and the Senate?
Well, let's just say for the top, I'm holding out hope that we're going to be able to flip the Senate. So let's just, acknowledge that, yes. But no matter what, I think that there are areas that we can find common ground. So to start, the Violence Against Women Act reauthorization stalled last year, which is so shameful. We passed it in the House. It's just been sitting in the Senate. But I think it's going to be different next year because we're going to have a new president that the Senate's going to have to find a way to work with. And so I think that we're going to see more pressure on the Senate to work with the House to find compromises in certain areas. And when we think about legislation like VAWA that people understand, like this is not like opaque, it's not abstract, like people get it. And we also have a president who will be someone who's an expert in this area, right? Joe Biden was the original sponsor of the Violence Against Women Act in the 90s. So I'm optimistic that that will be a priority for him to move through the Senate. And then beyond that, I think that public opinion on gun violence is shifting in a way where it's only a matter of time that we will see shifts here in Congress, right? When we think about the progress that's been made over the last several years to do something, right? We know that the American people are with us. Polls have found that over 90% of Americans support background checks, for example. And that's not, it's not 90% of Democrats, it's 90% of Americans. And yet, 1 in 5 gun owners made their most recent gun purchase without a background check. And that's not what people want. And in this country, we all know we're in a democracy. And even if this democracy is not running as smoothly as it should, extremist politicians will no longer be able to get away with ignoring what people want for very long. And that is what we've seen happen. These folks are so out of line with the mainstream point of view, so out of line with the will of the majority of the public and of the electorate, which, are not always the same thing. And so that's why I think that the work that groups like yours do is so important, because you've been chipping away at this issue for decades and built the groundwork. And obviously in the last several years, we've seen considerable momentum, especially as young people have taken this issue on. And so I know that together we're going to be able to hopefully move beyond just the background checks, because there's a lot more on this agenda that would allow us to save lives.
Thank you. We are so lucky to have a champion like you who really gets that, we have to be doing so much more to stop gun violence. One of the pieces of legislation that we feel is really important is your Lethal Means Safety Act, which you introduced just a few months ago. Can you share a little bit about how our research helped inform your thinking about how you crafted that bill and kind of why it's so important?
Yes. Oh, well, first of all, oh my gosh, I'm so thrilled that we were able to work together in this way. So I'm really honored to serve on the House Veterans Affairs Committee. And we know that suicide has unfortunately reached epidemic levels among America's veterans. Firearms are the most lethal method of suicide, and that is, if someone attempts suicide, the chances of that attempt being fatal, it varies depending on what method that they used, and firearms are the most deadly method. So an important piece, a critical piece of suicide prevention is reducing access. Well, you can still see me, can we? I'm in the office, we have these energy saving ones. Reducing access to lethal means like firearms for people who are at high risk of a suicide attempt. And so veterans, of course, tend to have a lot more experience with guns, and many of them are gun owners. And sadly, we're seeing in the data that veterans who attempt suicide are more likely to use a firearm in that attempt and are more likely to die. And so a lot of what we know about this problem is thanks to the coalition. Your Ed Fund released a major report last year on firearm suicide among service members and veterans that collected the best research on this problem. And that report was so helpful to me and my staff as we developed our bill to address this issue. We were also able to work closely with your policy team, your experts who advised us as we drafted the legislation, getting your feedback on bill text to make sure that we ended up with a strong and effective and evidence-based policy. So finally, in August of 2020, we introduced the Lethal Means Safety Training Act, and we held a hearing on it with the Veterans Affairs Committee. And so what the bill does is make sure that healthcare providers and other personnel at the VA are trained in lethal means safety counseling so that they can identify the veterans who might be at risk of suicide and work with them and their families, both, which is important that we have the ability to work with both to temporarily reduce their access to lethal means that could be used for a suicide attempt. And for me, the key piece is making sure that we had all VA staff that needed to have access to this training be included in the bill, and we were able to do that. So I look forward to continuing to work with your team to get this bill enacted and to keep finding ways, evidence-based ways to reduce gun violence, because this is a problem that we can solve. And I'm really glad to have partners like you. I also just want to say this bill has gotten some interesting attention, because as you all are, very well aware, the backstory is that this is something that the Trump administration and their suicide prevention team was standing firmly behind. And yet, due to some partisan politics here in the House, and it was really the Senate, let's just call it out, we were not able to get it included in a big package this year. The New York Times did an excellent article about it, but we're not giving up, just like you all haven't given up. And we owe so many families around the country action on this issue. And so we're in the fight, and I'm grateful for your help.
Thank you so much. 2020 has been quite the year, but working with your office has been kind of my greatest accomplishment, something I'm so proud of. And, even though we didn't get it across the finish line, we're going to keep working because it is just such an important bill. And so it is just such an honor to be able to work with you and your staff on this. So thank you so much. And
thank you so much.
Thank you. Awesome. So it's just so exciting to be with you right now. But we so appreciate you taking your time. I know that there's votes happening, and so really appreciate you taking your time to share your insights with us right now, and to continue working with you in the future.
Yes, thanks everybody. Stay safe, stay healthy.
Thanks, Congresswoman.
Thanks.
Thank you, Dakota. Really appreciate that. I noticed that Mike Feuer has joined the call. Mike, welcome. We'll be with you in about after the next session, quick session. Thank you for taking time out of your busy day. Right now, I'm going to bring our discussion with Jen and Lauren Footman. And start with Miranda Viscoli. Really interested. We just heard some federal perspective, really interested in some of the state perspective. So Jen, Lauren, take it away.
Thanks so much, Josh. Miranda, we're so excited to have you with us here today. Thanks for joining us. I just want to preface our discussion with an overview of our philosophy of state work. As we work within the public health model to advocate for evidence-based policies, it's really critical that we work with a broad coalition and with partners And Miranda, as you know, we prioritize state and community organizations on the ground. You really are the foundation and the potential of this movement. And to support true movement building, we prioritize building up organizations like New Mexicans to prevent gun violence through policy, technical, and financial support. Our work as gun violence prevention advocates is stronger with stronger partners. So thank you for everything that you do. We've worked on a number of successful issues in New Mexico together. And what do you think is the synergy between our work together and your activism? And what has our work together brought to the gun violence prevention movement in New Mexico?
Thank you very much. So New Mexicans to Prevent Gun Violence, we began in 2013. We were simply a group of advocates that was concerned about the issue of gun violence. The Sandy Hook shooting had just happened, but we also had horrible numbers in New Mexico in terms of gun violence. Like I said, we were a bunch of advocates that honestly, we really didn't know what we were doing. And the coalition basically back in 2013 took us under their wing, and they helped us set a very strong, extremely strong foundation through a public health and equity lens. And from day one, that's the direction we went in. And I don't know if we would have figured that out for years. So the coalition basically helped us, collaborated with us in a very holistic way, and were crucial in getting a conversation started in New Mexico where there was none. And so the first thing we did with the coalition was we looked at what violence prevention laws we have and what gun violence prevention laws we don't have. Well, obviously the conversation about what gun violence prevention laws we have is extremely short because we literally had no gun violence prevention laws. For 30 years, the NRA had been in this state decimating any chance of us passing some common sense gun violence prevention laws. So in fact, to the point where our Senate Majority Leader, Senator Peter Wirth said, for decades, where are the advocates on gun violence prevention? Look what the NRA is doing to New Mexico. And he said, then I turned around one day and there was New Mexicans to Prevent Gun Violence. Well, with New Mexicans to Prevent Gun Violence was the coalition. And we worked as a team, and we have been since 2013.
And so over the course of our collaboration, you've accomplished some really important successes in New Mexico, passing an extreme risk protection order, a domestic violence relinquishment bill. So can you just comment specifically about our collaboration on the domestic violence relinquishment bill? And then as we move forward into the work that we're doing with ERPO policy and implementation.
Yeah, so basically, like I said, we were looking at with Josh and the Coalition and Educational Fund on what gun violence prevention law could we possibly pass in what, gun-loving New Mexico, right? And so the coalition taught us very early on to ask two very important questions. And now as we have expanded and have a multi-pronged approach to gun violence prevention, we actually still ask these two questions with everything. One, is it possible? Two, will it make a difference? Is it possible in gun-loving New Mexico? We have to be very specific as to what we go after, right? And so we were looking at data with the coalition, and we were looking at the high number of intimate partner homicide. It was tragic how many women, mostly women, and children were being shot and killed in these domestic violence incidences. And also we were asked, well, is it possible? Yeah, that is possible here, because it's very hard for somebody to argue that somebody who is beating their intimate partner should have a gun during that time. And also we had the high numbers to prove it. So we answered both those questions. So the coalition worked with us literally for 2 years. We have a wonky system here in New Mexico where we hardly ever meet. That may be good, that may be bad. I still am on the fence on that one. And so the first thing we did was we put a stakeholders table together under the guidance of the coalition that included our attorney general, included state police, it included domestic violence advocates, suicide prevention advocates, judges, gun owners, NAMI, and so that we could really hammer out a bill that worked. Again, like I said, we were advocates. So the attorneys from the coalition flew down on several occasions. Their public health policy people flew down. They were a part of these stakeholder meetings, and it really showed what true collaboration between a national group and a new state group or a state group in general could look like. They were very careful also to always make sure that it was New Mexicans to Prevent Gun Violence that was the voice, because the last thing New Mexico wants is a group in Washington telling them what to do with their guns. Like get dead on arrival, right? That is not going to happen. And so they were always really respectful to make sure that we were the ones that were the voice, but helped guide us in passing the bill. They were also extremely helpful. And we know how tricky the NRA is, right? They sneak a little change in a bill that completely unravels it. And in New Mexico at the time, you could make a committee change very quickly. And so again, we weren't attorneys. So we had them on the phone and we'd say, I'm smelling a rat here. This could be going south. And they would say, yeah, you're right. And A, B, and C, this is what you say, because they were the attorneys. And that made it so that we could pass an extremely strong domestic violence relinquishment bill. The same way that we're working on ERPO now, and we're hopefully making some amendments on our ERPO bill.
Thanks, Miranda. That's fascinating. And I'm wondering if you could just talk very, very briefly before Lauren jumps in, because I know she has some great questions for you. Just a little bit about our future collaboration under ERPO and some of the work that we're going to do together in the near future.
Yeah, so we're really excited about that. We're right now we helped pass the ERPO bill. There were changes that need to be made so that we can implement it correctly. So right now we're working with the attorneys at the coalition to make sure that those amendments get passed this next legislative session that's coming up in January. In addition to that, the coalition and the educational fund has been a gateway to funding for us in terms of being able to, after we get these amendments done, get training to law enforcement, to judges, to courts, to our Veterans Affairs, to really help make sure that we are implementing ERPO as best we possibly can. And we all know here, a law is only as good as it's implemented. So we look forward in that collaboration coming up in the next year.
You know, I'm so glad you're able to point out implementation, because it's such a key part of the public health model that we need to make sure it's just as important as enacting a law as we need to make sure it's being implemented and assessed so that it's working. So I'm so grateful that we have that opportunity to work with you on that. And I know we have the opportunity to work with you and Lauren as well. So Lauren, I'm going to send things over to you.
Thanks, Jen, and nice to see you again, Miranda, even if virtually. So this is really a good segue to talk about our work together to engage local communities. You're a significant leader in the New Mexican gun violence prevention movement and bringing together large, diverse coalitions within the statewide movement. Our values and prioritization of racial equity, as it runs through all different facets of our work, aligns with your same values of racial equity and advocacy. Can you speak to how your equity and diversity practices, our work together on some racial equity issues, and how it has expanded the opportunities for more diverse groups to participate in policymaking?
Definitely. So from day one, we saw that you really need a multi-pronged approach when it comes to gun violence prevention in New Mexico. You know, we have your folks that think of gun violence prevention as a four-letter word, right? You know, we're just trying to take away their guns. So those folks we have to try to have a conversation with. Sometimes we're successful, sometimes we never will be successful. But from day one, we saw in the research we were doing that gun violence is a civil rights issue in New Mexico. Gun violence is a civil rights issue in the United States. And what we saw immediately was that we needed to find a way to disrupt the intersection of gun violence and racism. That was our focus from day one, because in New Mexico and in the United States in general, you have this systemic perpetuation of oppression through laws, through policy, through practices. In New Mexico, through our multi-billion-dollar prison industry that is inextricably linked to gun violence and racism. And our job, as I see it with New Mexicans to prevent gun violence, is to obliterate that link, because it's hurting the health of our families. Much of the work we do in New Mexico are with youth, programs that we have created. The majority are youth of color. The majority are youth living in high-risk situations. Many of them, I would probably say 99% of them, have been victims of gun violence, have committed gun violence. Oftentimes it's both. We come from a perspective that if a 16-year-old has a semi-automatic handgun in their hand and they do something unfortunate with it, then that's on us, right? Then we failed that 16-year-old kid. So we see our work at New Mexicans to prevent gun violence through the programs we've created is how do we scaffold those youth so that they can lead a healthy life and not have gun violence be a part of that story. And we're very adamant in that. And also making sure that laws don't get passed that would disproportionately put more youth in color in jail, right? So we're expanding our programs now to include restorative justice circles with our schools, with our police, so that we can reduce the recidivism rate of youth getting in the juvenile system. We can stop it ahead of time. We're also really excited about working again, once again, with the coalition. So we're working with you on the diversity, equity, and inclusion group. We were a part of that's when I met you, part of our the interview on racial equity and moving that forward. And we're excited and blessed to continue to be able to have such a strong partnership.
Thanks, Miranda, for sharing those great examples, and we look forward to continuing our partnership with you as well. Your commentary thus far illustrates that building your ground game and working hard to include community feedback and policy creation builds a framework for lasting progress, and we definitely agree with you on that. Are there any policy efforts or broader equity efforts you are looking forward to in the upcoming year, outside of course, our work together with the Diversity, Equity, and Inclusion Work Group?
Yeah, so what we're going to do is, like I said, working on creating real restorative justice throughout communities in New Mexico. In addition to that, working on the extremist protection order and making sure that's implemented correctly and fairly, and working on also the domestic violence relinquished order law that we passed, to watch courts and make sure that judges are doing the right thing. We're starting to hear some noise that judges aren't necessarily doing the right thing. So we will continue those programs that we've already created, as well as expand in that way.
Thank you for that. We are definitely proud to partner with you on this important state legislation and community building, and we are definitely committed to continuing our support and technical assistance as it relates to diversity and equity. Your work with New Mexicans Against Gun Violence is such a great example of what is possible when state groups and also national groups are able to work together. Thank you again for sharing your thoughts and your efforts in New Mexico. I'll hand it back over to Josh.
Thanks, Miranda. I really appreciate that. Lauren and Jen, great job. We're looking forward to replicating some of the success in New Mexico around the country. I'm going to turn to Mike Feuer, the LA City Attorney now. Mike's been a long-term friend of the coalition, a long-term friend of mine, someone I've worked with a long time. We worked together to pass microstamping in the California legislature when he was an assembly member, and worked together many times as City Attorney. I want to start with a little anecdote about how much data matters to Mike. So we were at a brunch, a Sunday brunch. We're both in town. I was in town working, and it was a Women Against Gun Violence brunch. It's a really nice thing, and Mike was there. And Mike's a little taller than I am, so he came over to me, put his arm sort of around me, looked down at me and said, "Josh, we want to pass this bill. I need more evidence and data." And I said, "Yes, sir, we'll get it." I went out, we developed a new study around this, looked at some new evidence, and Mike honored his promise and got the bill passed. So I've always been incredibly impressed, Mike, with your commitment to data, your intellect, and your drive to get things done. So thank you for being here with us. As a city attorney, as someone who works in city government, can you tell me a little bit why that public health approach has just been so important to you, not in this role, but all the roles you've had?
Yeah, of course. And Josh, it's great to be with you and the coalition, and thanks for the opportunity. And I too very deeply appreciate our very long-term collaboration. So thank you for that. How could it not be a public health issue? You know, when we have 80,000 firearm-related injuries every year and almost 40,000 people die from firearms every year, when 8 kids die every day from gun violence, how could it not be a public health issue? You know, 60% of gun deaths, as we know, are attributed to suicides. The justice system in itself, in the most narrow sense, it simply isn't equipped to deal with this issue. And it's not just, by the way, the immediate physical impact of gun violence, but as we know, the trauma experienced by kids, for example, when they're exposed to gun violence, whether they're the victim or just in the neighborhood, can alter their brain development forever. So I have for years shared your focus on gun violence as a public health emergency. And it's a key reason why we also have in common the approach to a risk-based firearms policy, taking into account risk factors like drugs and alcohol, mental instability, again, data that reflects a propensity to violence. I mean, I think it's extremely important for the conversation in the nation to be it's just obvious as a public health discussion and not just a discussion involving the justice system. And, you know, we've seen this dynamic play out where doctors have come forward and said, this is our lane, even as opponents of gun violence prevention say, stay in a more narrow lane. We know better. So these are reasons why it's been obvious to me that we have to think of this as a public health as well as a public safety emergency.
And that's interesting. I mean, tell me, is oftentimes we don't think of prosecutors involved in prevention, but you're so deeply involved in prevention. Why is that important to you as a prosecutor? Well,
because, you know, my role as city attorney is both civil and criminal. So we prosecute and do civil litigation and advise the government here on legal issues. But when we prosecute, it means there's been a victim. And for us to be able to prevent someone from being victimized in the first place is essential. And by the way, preventing gun violence takes so many different forms. So for example, we prosecute to intervene when a gun hasn't been safely stored in the hope of preventing a problem in the future. We, as you're well aware, we have a protocol that we've worked on with you and others to make a national model to assure that domestic abusers don't have access to guns, to prevent the potential for the partner to be killed when we know that that person, typically the woman, is 500% more likely to die if there's a gun in the equation of domestic abuse. So there is very direct application from, you know, the theory of prevention applies extremely specifically to precise strategies we can employ in an office like mine. And let me just take this for 1/2 second and make it more expansive, because I mentioned trauma earlier. One program we have that does not directly prevent someone from using a weapon they might have access to shoot somebody, but prevents other issues, is tied to the trauma that kids who are exposed to gun violence experience. We have a program where we collaborate with a project that intervenes with preventative psychological intervention with kids who are exposed to trauma, so that when we look to see what is the area of the city with the most shots fired calls, we identified that data point. Then we collaborated with this team that goes out with us and LAPD and neighborhood advocates into the field when there's a shooting, looking for kids who might have just been exposed to the fact of the shooting. And then they're offered therapy right away and the next day. And then we go to schools and speak with administrators and teachers and parents about the signs that a kid has been exposed to trauma, so we can provide that immediate intervention. Because as I said earlier, we know that if that trauma isn't intervened with almost immediately, the brain development of that child is never going to be what was biologically intended. So anyway, we have a very expansive view in our office of public health and the intersection of gun violence prevention.
Look, that's fantastic, because obviously exposure to violence is a big risk factor, and addressing that as soon as it happens is important. And congratulations to you as a prosecutor for understanding that you need to get down into the weeds and the root causes. So thank you for doing that. I'll just send this for one last question. So we've had a congresswoman, we've had someone who works at the state level. You've worked both at the state and now the local level. How important is it to remember to work at the local level?
Oh, it's critical. And, you know, I had the opportunity to speak with a governor and a mayor at a White House convening, talking about this very issue. And what I said then, I will repeat here. When I was a city council member, maybe 20 years ago, there was a real stalemate in Sacramento in our state legislature when it came to gun violence prevention. And I thought that if we did work locally, we could be the catalyst for changes in Sacramento. And that's exactly what happened on legislation like One Gun a Month, you know, designed to prevent people from accumulating weapons and in dealing with weapons trafficking. We also work not just in the city of Los Angeles, but to create a regional approach. In the absence of work in our state capital, we worked with the leaders in jurisdictions immediately surrounding Los Angeles to create a common set of gun violence prevention rules. And at the state level, in the absence of federal action, again, it's imperative that we work, because in California, for example, we know the fact is that those jurisdictions that have the toughest laws designed to prevent gun violence have seen the steepest decreases in gun violence over the course of time. And the last thing I want to say, though, Josh, is this. A challenge that all of us confront now is common to Los Angeles and every major urban center in the United States. We are now seeing a dramatic increase in shootings happening everywhere. Yeah. And we've been struggling, I will say, to identify how we grapple with the root causes of that increase in gun violence and what interventions we can put in place to put a stop to it. So I would welcome your insights as we deal with the next iteration of our collaboration, 3.0, how you can help us zero in on that, because I think from New York to California, there is a critical need to abate that increase in violence that's coincided with the pandemic.
Well, thank you, Mike, and I accept that we will definitely be talking about that. But I'll say, if you apply the public health model, which it says, when you think about it, in an equity lens, is try to go upstream, as much upstream as you can, right? So when someone has it, you said this, or Miranda said it, when a 16-year-old has a semi-automatic assault weapons in their hands, that's a system failure, right? But that's the last step before someone gets injured. It's, we want to start working more upstream. You want to address some of the root causes, especially in community violence, right? That's something that's incredibly important to do. And we look forward to collaborating with you on that. I ask you, if you want to, you can stay around for a couple more minutes. We're gonna take some questions. And this is not only just to our invited guests, but to our staff as well, if people want to jump in there. But someone asked a really good question. Hey, we're in the middle of a pandemic and almost 300,000 people have died or will die or more because of this. Mike, I think that's one of the reasons we're seeing, the economic desolation because of this is one of the reasons we're seeing the death rate go up. Is there reason for hope for a public health model in the middle of a pandemic? I would argue it might be our only reason for hope, but I'm gonna open that up. Miranda, you've used the public health model in a very difficult circumstance, and then I'll go to you first, and then anybody else can jump in.
Oh, I think there's hope, and I think I think we have a lot more work to do, and especially in terms of what's going on with the pandemic. There are too many guns in New Mexico. We started a program last month called Groceries for Guns, where we're doing gun buybacks and we give grocery cards so that we can start. And over half the guns we're taking in are semi-automatic handguns, assault rifles, assault weapons, sawed-off shotguns, and getting those guns out of homes right now, that's crucial. We've partnered with the Food Depot, for instance, to get gun locks. So while they're dropping off the food, we're giving them a free gun lock so that our youth that are home get those guns locked up. So, I think we have to kind of think outside of the box because of COVID. I don't know if that answers your question, but, really getting some grassroots group to work done to get those guns out of unsafe hands.
Anybody else want to jump in on that, on the public health model in this pandemic?
So the one thing that I'll say is, I think in some ways our work is going to be harder as we see more gun violence with economic frustrations and with domestic violence issues, people being at home and having domestic violence being exacerbated. And if there's a firearm in that home, we know it's going to be more likely to escalate to homicide. And I think there's lots of legislatures who are going to be really focused on addressing the crisis of COVID and budgets to address the crisis for COVID. But I think the good news is that the pandemic has shown us that there are many health equity disparities that have the same root causes of gun violence as they do with some of the disparities that we're seeing within the COVID pandemic. And so as there are legislatures and lawmakers who are using this health equity lens to start dealing with the root causes of those health disparities, I think we're going to see better solutions too in terms of treating the root causes as well of gun violence. So I'm hoping as we look at everything systemically, we're going to see stronger and more meaningful long-term solutions across all of these issues.
Mike,
And Josh, I want to say, it is in some ways miraculous that we haven't seen a even more significant spike in gun violence during the pandemic. Because if you consider all the approaches that we've taken to abate gun violence, so many of them aren't available now.
Yeah.
And look, if you have the following factors combined: an economic downturn, people aren't working, people are frustrated. The gang intervention work on a person-to-person basis has slowed down. Programs that deal with youth don't exist right now in parks and recreation centers and locations like that. Schools are closed. All the kinds of intervention opportunities that we have relied on over the years when there's been an escalation in gun violence are not available to us at this moment. At least the majority of them are not available. So it makes the challenges especially acute. And this is why I've been struggling here locally, and I'm looking for other insights from across the country as to how to grapple with this issue. I do think that with the coming vaccine, we're going to see the curve of gun violence begin to flatten to some degree as well. When that happens, the next question is, will there be an opportunity for the more robust legislative interventions that we've been looking for a long time? I think until that happens, it's unlikely. When that happens, it's possible.
And I'll just wrap that up by just saying, we see what happens when countries actually use public health interventions. They save lives. And we see it in our tragic example in the United States, what happens when we don't. And so I think a lot of people have been exposed to how important a public health model is. So I am hopeful that when this is over, that we will be applying that. All right, so there's a lot of questions, and we're going to sort of do kind of a lightning round, I guess. So let's start with people always want to know, but isn't the NRA going to stop all of this? And although I know that Miranda said there was difficulty in New Mexico with it, you ultimately have been prevailing. And I know that the NRA has all sorts of scandals, financial scandals and international espionage scandals. What's it like on the ground? How are you winning?
In New Mexico, we're doing great. I mean, I think that the NRA has been on defense since we started in 2013. We blocked every single one of their gun violence prevention bills that they've tried to move forward, and we've passed 3 gun violence prevention bills in 4 years. I don't think their voice is as strong as it used to be honest. I think they're realizing that the game's up. People are dying. People have been dying, and the buck stops here, right?
Yep. All right, I got a couple of questions for I think Dakota on this, or we got a question about what is an extreme risk protection order?
I can hop in. So an extreme risk protection order is a state level policy that is now in place in 19 states and DC. It kind of has a lot of various names. In California, for instance, it's called the Gun Violence Restraining Order, or GVRO. Colloquially, it's kind of called the red flag law, but we call it an extreme risk protection order or an extreme risk law. And what that is it allows eligible petitioners, usually law enforcement or family members, to petition the court to have a civil order issued against a person who is at risk for harming themselves or others. And what it does is it usually, for the long order, is 1 year. And so for that year, the person is unable to purchase or possess firearms. And they also have their firearms actually either removed or they have to surrender them. And what this does is, one, risk fluctuates over time. And so someone who is at elevated risk of harming themselves through suicide, and they're showing these risk factors for suicide, they're talking about wanting to die, they just recently bought a firearm, they're drinking a lot, those are clear risk factors. And so family members who are concerned about their loved one, who may be not willing to give up their firearms, they can go to the court to actually petition for this order and have it granted. And since risk does fluctuate over time, the order ends in 1 year. And then if that person, has dealt with whatever that underlying issue may be, the alcohol use, and they're no longer at risk, then they get their firearms returned after 1 year. And in some states, if that risk is still elevated, they can petition to have the order renewed. And so we've actually are seeing this work really well across the country. There's emerging evidence from actual research that shows that it has been shown to prevent suicides as well as mass violence. In California, there's research that has showed it was used to help 21, I believe it was, the number was 21, but 21 mass violence events. So it really is a preventative tool, and it allows that person, for whatever their risk factors may be, to actually deal with that underlying issue, whether that, again, is alcohol, maybe drugs, maybe they lost their job, they got divorced, whatever it is, they can deal with whatever that issue is, but in a safer space where they don't have access to a firearm to either harm themselves or others. So it's something that we really find important because of the prevention aspect of it.
We might have a new report on that, right?
Yes, we also have a new report. Thank you, Josh. So we convened this group called the Consortium for Risk-Based Firearm Policy that Josh actually helped, or he did create in 2013, I believe. And it's a group of some of the leading academic researchers across the country. And they're actually the ones who helped create the modern day extreme risk protection order back in 2013, or back in 2014, following the Sandy Hook massacre. And so we worked with the consortium to just update those recommendations. We can drop that in the chat, the new report, but it's something that we use to speak to legislators at all levels of government and to guide our recommendations on how to make the extreme risk protection order effective and implemented in an equitable manner.
Great. Thank you. So we're getting close to the end. We're going to wrap up in a few minutes. There's so many questions. I apologize. I won't get to them, but we will try to find other forums to address them. But Mike, maybe this is a question you can help us with. People have said, well, public health approach is great, but what about these ghost guns or 3D guns that are, 3D printing guns that are going around the laws we've worked so hard? I think you're seeing that. I think that's been a big problem in California, I think. And so have you seen that in your office, this ghost gun issue?
Yes, and it's a major concern, and we're focused on it in a couple different ways. At this moment, there is litigation underway on this issue, a couple different cases, and we're going to be involved in that litigation. We're going to be providing key data points, for example, to assure that courts are aware of the gravity of the problem. In Los Angeles, we've seen a meaningful increase in the number of ghost guns involved in criminal activity here. So there is, and we're also involved, of course, working with our police department to try to find ways to intercept ghost guns, but that's a tough thing to do. The federal government, as you know, Josh, has an interpretation of what constitutes ghost guns that needs to be altered in order for the federal and local approaches to be more effective in getting them off the street. That's what the lawsuits are about, and I'm looking forward to having an impact in those cases.
Yeah, so that's a good point. I think we're gonna need to work hard. Dakota, just one second on that before we wrap up. If is there a ghost gun bill in Congress? What do you think we need to get done there?
Yes, so there is a ghost gun bill in Congress. I'm looking up the actual bill number. So right now it is HR 3553 and S3743, and it's been introduced by Representative Cicilline and Senator Blumenthal, and it would prohibit the manufacture, purchase, or possession of ghost guns, which again are untraceable guns. And this is something that really is getting traction in the federal landscape. And I know it's something that our group and many other groups are going to be pushing in the next legislative session and with the new Biden administration. So those bills will get reintroduced next year, and hopefully we can actually make some progress on them, because this is something that is a huge threat that is starting to gain traction, but for so long I think has kind of gone under the radar. And so it's something that is very deserving of our attention, kind of, again, at all levels of the government.
All right, thank you. I'm gonna wrap up for now. There's a lot that we could have gone into today. I can tell with all the questions that we should have scheduled this for a couple of hours. Maybe next time we will. We are going to, please feel free to email us. If there's questions that we didn't get answered that you want, that we didn't get to, that you want answers, you can email us at csgv@csgv.org. Maybe we could put that in the chat. We want to be engaged. I know there's a lot of our partners out there. We want to be supportive of you. So please, we're here to help. We're here to help with the tools that we've described before. We're here to be a good partner. Please stay engaged. If there's questions we didn't get to, email us, and we will do our very best to get back to you. I think there's a couple things sort of synthesized that I want to say, and I think it's great to have the Congresswoman and Miranda and Mike here today, which is, we need to find opportunities. We can work and develop these reports, but we need to find opportunities to get in the field and apply the public health model. And that means knowing a lot about it. It also means having great partners. And again, for the three of you, I'm so grateful that you work with us, that you have faith in our work. And for all of our other partners listening, thank you for being there. That's what makes this work, do good, and save lives. So that's all the time we've got for today. A great panel for the staff that was on this. Thank you for Congresswoman Underwood, and for Miranda Viscoli, and for LA City Attorney Mike Feuer. Thank you. Thank you. I also want to thank the colleagues who were here. I'm very appreciative. And for all of you listening to this, I'm very appreciative of you being here today. I know I want to reiterate what Joel said and thank everybody for who has supported. And if you want to be a supporter, I think there's a link on how to support us in the chat. We're always very appreciative. It's the time of year of giving. So if you want to give, we're here to, and we'll be a good steward of your resources. So thank you. So thanks for joining us. Thanks for sharing our vision. Please, in this time, stay healthy and safe, and have a very happy holidays. Goodbye.